depends on, again, what type of care that you're getting. As far as bleaching, okay, say you lightened your teeth. If you never lighten, as far as studies go, that I've read, and in my residency program, this is actually something that I've reviewed. If you never were to bleach again, you know, our teeth get darker as we get older because the middle part of the tooth gets thicker. And what that is the dentin, okay? That's what gives our tooth color. The enamel is fairly translucent, so you're always just picking up what's underneath. So, if you lighten your teeth, in 5 years, if you never lighten again, you're going to be back to where you were, okay? But you're still going to be 5 years ahead of your age. But that's not how you're going to do lightening. What you're going to do is you're going to brighten them to a point where they don't get any lighter, and then just like when you need to get a haircut, or you need to, you know, have hair for women that get their hair colored, or you know whatnot. There's a certain period of times that you have to do that to maintain that. Well, bleaching is the same thing. Some people, to keep that nice bright smile, might lighten once a quarter, you know, every 3 months or so. Some people once a year. Some people will just do it before a big event. I'm going to lighten my teeth for a day or two right before I go for a wedding, you know, or something like that. So you'll always be able to maintain that. Your biggest investment is going to be just getting, you know, the trays made, or the initial bleaching. If you did something like Zoom or a different type of technique, there's a lot of different ones. That initial one's going to get you to that place where your starting point is, but then there'll be some follow-up. The follow-up is usually just the cost of materials, you know, which is very a nominal fee really compared to what the initial investment is. As far as things like veneers and crowns and things like that, it really is very dependent on many things. Just like dental disease is multifactorial, it has a lot of things factoring into it. How well does the patient brush? How well do they floss? What kind of things are they using their teeth for? Is it a fisherman that's trying to break the line off every time they're going fishing? Well, that veneer is not going to hold up to that over time. That's an example. Are you a nail biter? Okay, so there's things that the patient does, that if they have a clenching or a grinding habit. Just a number of things in that way that can affect how high is their cavity rate, that can affect whether or not that crown or veneer would need to be replaced. But if done well, the way we do them, where we look at the bite, ensure everything's good, and we have a patient that's taking care of things, I would say on average, when you look across the board, patients that do veneers or whatnot, I think the average in the literature and the studies show somewhere between 10 to 20 years, you know, 15 might be a good place to say, but patients that maybe don't get that long-term success, maybe their things are wearing out in 10 years or so, maybe they didn't have things looked at as far as the function. Was that correct? So that's on the dentist, okay, to make sure that they're looking at all those things for you. So if I was a consumer going out there and wanting to get some veneers, I'd be asking you, what all do you look at as far as how you design my veneers? You know, are you looking at my bite? Is that going to help it last longer? Then, for example, on the patient side of it, then my job with them would be to say, okay, how well are you flossing? How well are you brushing? Are you wearing a night guard if you should be wearing one if you clench or grind your teeth? And I think that we can get things that are much longer, much more successful. I did complete mouth reconstruction on my mom almost 20 years ago, and everything except for one area we had to replace, and that was a bridge that she did never floss. It was too hard, you know, so that's what we replaced in 20 years. So dentistry can last a long time. I know there's cases out there that are 30 years old, you know, so I think it's just all those factors into it. But the biggest thing is partnering with my patients on that. Okay, this is your role and how long this is going to last. This is my role, and together let's get long-term success.
Excellent.